Good evening, everyone. Myself, Suhas Yadav, studying third professional BMS at Atraya Ayurveda Medical College. It gives me a great pleasure to welcome you all to the special lecture series on KAYACHIKITSA, Paper 2 Part A, curated especially as a comprehensive revision aid for fourth year BMS students. Today, we are honored to have with us Dr. YADU GOPAN sir, a highly respected teacher, clinician, and academician in the field of Ayurvedic medicine. I take pleasure to introduce about sir. Sir is currently associate professor, Department of Kayachikitsa, SDM College of Ayurveda and Hospital. Sir, you can take out the session.
I'm audible, right?
Yes, sir, you can carry on, sir.
Okay. Can you see the PPT? Is it visible? I hope the PPT is visible, right? One minute. Is the PPT visible now?
Sir, slide is not visible. You are audible, sir.
Okay, once again I'll share. Now it is visible, right?
No, sir.
What about now? Can you see the PPT? Is it not visible now? Am I audible now? Can you see the PPT now? Is it visible now? Is the PPT visible? So, thank you for the introduction. I am Dr. YADU Gopan, Associate Professor in the Department of KAYACHIKITSA, SDM College of Ayurveda and Hospital, Hassan. So, as a part of the exam orientation for final year UG students, I am going to take the paper 2, part A, in that point 3, that is Annavasrota Vikara. So, in basically before going to the individual disease, it is very much important to understand the basic nature of the Annavasrotas. So we have a good number of diseases coming under this particular Srotas, and the basic, the consideration needs to be given to Agni, just like Sarve Roga Mandakno, as according to Ashtanga Hridayam. Agni doshan manusyanam roga sangha pradagvida malasangha malavridya pravartande visheshana udaranitu, according to Charaka. So almost all the diseases are originated from the Agni Mandya. So especially in the Annavasrotas, all the diseases coming under Annavasrotas are related to Agni in some or the other way. Or the origin itself, we can say it is from the Agni level. So whatever disease we are discussing today, everywhere you need to consider one thing, that is Agni should be kept in normalcy. If Agni Mande is the cause, go for Agni Deepana. And so there is a disease called as Bhasmagaraga or Ati Agni, where you have to control the Agni. So ultimately the normalcy of Agni needs to be maintained in the case of Annavasrota Vikaras. So in this presentation, we'll be dealing about the different disorders like Agni Mandya, Ajirna, and the complications of Ajirna like Alasaga Vishujiga Vilambiga, then Grahani, Chardi, Shula, Gulma, and Bhasmagaroga, Amla Pitta. These disorders will be discussed today. So, starting with the Agni Mandya and Ajirna, and we are not going to discuss in detail about the Nidana Panchaka because as it's a part of Kaya Chikitsa, we will be discussing more about the Chikitsa aspect with its different types of treatment and Avastika Chikitsa, Vishesha Chikitsa, all those things. So starting with the Agni Mandya, as we know, basically the cause for all the diseases. According to Madhava Nidana, Anatmavantaha Pashuvat Bhunjade Yo Apramanataha Roganikasya Te Moolam Ajirnam Prapnuvatihi. So a person who used to consume the food just like an animal without any control, without any quantity, without any timing also, and apramanata, that's again about the quantity. So this kind of ashana, this kind of pattern of ashana or food intake can lead to the diseases. Basically different disorders can occur from this, and the base is nothing but the ajirna. So directly these type of ashana will be leading to ajirna, and from ajirna again there can be occurrence of different other disorders. So before going to study the abnormalcy or pathology, we need to study the physiology or the normalcy. That is nothing but a Jirna Ahara Lakshana, as we know from the Madhava Nidana. Udgara Shuddhirutsaho, Vegotsara Yedojidaha, Leguda Shuddhipasacha, Jirna Aharasya Lakshana. So these are the Lakshanas to be observed after the proper digestion of Ahara. And if these are not occurred, obviously it is nothing but the Ajirna. So briefly about the Nidanas of Ajirna and Agni Mandya. So together I am discussing because Agni Mandya may not be producing the symptoms directly. So Ajirna may be the outcome. Uh, can you see the slides? Uh, can you see the slides? Okay, basically about the nidanas of Ajirna in brief, if you discuss Aharja nidanas, Viharja nidanas, Manasika nidanas, and other Panchakarma, Apachara, Rutu, Kala, Desha, Vaishamya are also there. So any type of asana, abnormal asana like Atyashana, Adhyashana, Ajirna Ashana, Vishamashana, Akala Bhojana, Asatmya Bhojana, Sandushta Bhojana, and again Viruddhahara. These are again the basic cause of Agni-mandya. Viharas like Vegadharana, Swapna Vivariya, Rati Jagarana, Diva Swapna, all these are again. And some of the Manasika Nidanas like the basic Manasika Nidanas like Irshya, Bhaya, Krodha, Dvesha, Chinta, excessively can also lead to Ajirna. And improper administration of Panchakarma therapies can also lead to Agni-mandya and Ajirna. So coming to the types of Ajirna, we have basically, as we know, three types based on the dosha, that is Amam, Vidagdam, Vishtabdam, that is Ama due to Kapha, Vidagda due to Pitta, and Vishtabda Ajirna due to Vata. And again, the other three types like Dinapaki Ajirnam. So initially Rasashesha Ajirnam, Dinapaki Ajirnam, and Pragrata Ajirnam. These are another three types of Ajirna. So basically, we can say there are 6 types of Ajirna. In that, most importantly, you need to remember the first 3 types, which we are commonly treating. So we'll discuss the briefly about the symptoms of these kind of types of Ajirna. That is, in the Ama Ajirna, there can be symptoms like Guru Gaurava Utkleda, again the Hrilasa, Shodha, that is Gandakshi Kuda Shodha. Ajirnam tu Kafada me Tatra Shofakshi Gandeva according to Ashtanga Hridayam. Then Ajirna, basically Ajirna is the election of this Ama Ajirna. And again, Vidagda Ajirna, similar to that of Amla Pitta, just like we can consider it as a Pura Rupa of Amla Pitta, like Brahma, Trishna, Murcha, and again, Tikta Amla Udgara can be there, or Dhuma kind of sensation can be there during the Udgara. Sveda, Daha, these are elections of Vidagda Ajirna, which is caused due to Pitta. Vishtabda will lead to Shula, Atmana, and different types of Vata Vedana, Vibandha, Vishtabda, Manila, Chulam, Vibandha, Atmana, Sadhagrita, according to Ashtankade. So these are the basic kind of Dosha Ajirna. And most importantly, one thing is that is Rasashesha Ajirna. So what is the difference between this Dosha Ajirna and Rasashesha Ajirna? Dosha Ajirna means there is actually absolutely no digestion. That is totally the food as such, undigested food will be staying in the koshta. Whereas in Rasashesha Ajirna, there is some sort of digestion and the Ahara Rasa is formed. So Ahara Rasa is formed there, but that is not being absorbed or assimilated. This is the condition where Rasashesha Ajirna. So in all the other kinds of Ajirna are Annaja Ajirna, and Rasashesha Ajirna is Anna Rasaja Ajirna. That is, Ahara Rasa is formed, but that is staying in the koshta, that is not being utilized or assimilated or absorbed. That is Rasashesha Ajirna. And Dinapaki Ajirna means after the food intake, it takes Ahoratra, 1 full day for the digestion of the food. That is Dinapaki Ajirna. Prakrita Ajirna means it is quite natural. There is no, it's not a disease also. Immediately after food intake, we are not, there is a particular time, 1 yama time needs to be spent for the digestion. So within that 1 yama, the food will be again in the process of digestion. That is nothing but the Prakrita Ajirna. So coming to the chikitsa of different types of Ajirna, as we know, basically, according to Ashtanga, this is from Charaka, this is from Sushruta. First of all, I'll mention, similar thing is told by Ashtanga also. We have studied in first year BAMS. Langanam Karyam Ametu, Vishtabde Svedanam Brusham, Vidagde Vamanam Kuryat. So these are the chikitsa for Dosha Ajirna. Ama Ajirna, Langana is the chikitsa. Vishtabda, sorry, Vidagda Ajirna, Vamana is the chikitsa, and Vishtabda Ajirna, Svedana is the chikitsa. And again, the fourth one, Rasashesha Ajirna, Diva Swapna, Shayana. That means no need of any treatment there, because as we know, already the Anna Rasa is formed. It is not being used. So just you have to wait till it is being used. That is nothing but just lie down, that's all. It will, continue to, it will, its own, it will get assimilated or absorbed. So that is why it is Shayana is indicated in Rasrasha Ajirna. And basically for example, with so we'll have a discussion about the treatment for Ajirna. So Ama Ajirna caused by Kapha, almost similar to Ama, what we are calling it as Ama. Langana is the chikitsa. Langana means again, it can be anything. For example, Legu Ahara Rubi Langana, or complete Upavasa itself. And again, if you take the Dashavida Langana, also you get different types of Shodhanas are also there. But basically, Shodhana is contraindicated in Ajirna. But only one Shodhana that we can do here is the Sadhyo Vamana, not even Ajirna, Basti or Virachana. Only Vamana can be conducted because Vamana is nothing but just removing the Ama or Ajirna from the Koshta. So there is nothing related to the digestion. For Virachana to be carried out, first Virachana Dravya needs to be digested and then only the Virachana will occur. But for Vamana, this digestion is not a matter there. The drug will go inside, it will irritate and it will take the content out in the Pradiloma Gati. So that is why only in the case of Ajirna, the Vamana is a Shodhana indicated there. So in Vidagdha Ajirna, that is another question there. So in Ama Ajirna, Langana needs to be done. Upavasa or Lagu Ahara Rubi Langana. Vidagdha Ajirna, which is a Pittaja Ajirna, then why Vamana is indicated here? Because Vidagdha is again caused by Pitta, and the treatment for Pitta is again Virachana. So again, the same thing I told, for Virachana, digestion is very much important. And if you see the definition of Vamana according to Sharangadhara, Apakwa Pitta Shleshmanam Bala Durdam Nayatuyat. So first indication for Vamana is actually Apakwa Pitta, not Kapha. So Apakwa Pitta is seen in the Vidagdha Ajirna only. That is why in Vidagdha Ajirna, Vamana is the treatment. And for Vishtabdha Ajirna, Swedana is the treatment. That is Thanika Swedana we can do. Swedana also again, Abhindra Swedana like Ushna Jala Pana. So in the commentary it is again given. Swedana is for both Ama as well as Vata. Swedana is an Ama Vata Chikitsa. So as a part of Ajirna, there will be Ama. For that also Swedana is helpful. And Vishtabdha is basically caused by Vata. For that also Swedana is beneficial. So this is how you have to understand the chikitsa of these three Ajirnas. And Rasashesha I already told. And how to conduct the Vamana here? Vamaye Dashum Tasmat Ushnena Lavanambuna. Either with the plain Ushnajala or Ushnajala with the Lavana, that is Lavanambu, you have to conduct the Vamana. And followed by the Vamana. When you after Vamana, you need to again Anashana or Upavasa should be continued until the Prakriti of Agni or the normalcy of Agni is attained till that. So by doing the Vamana, you will remove the contents from the stomach or remove the contents from the stomach. That is nothing but the Ajirna undigested food will be removed from the stomach by Vamana. And for improving the Agni, you have to wait. You should not take any heavy food immediately after that. Continue the Upavasa till the Agni becomes normal. Lagukayam Adhastenam, Langanam Samubachare. So until for the Sharira Laghava again, Langana should be continued. Until the Agni, Bala, Dosha, everything becomes normal, this should be continued. So this is a general treatment of this Ajirnam. And again, difference of opinion, that is even in the according to Vaishyaratnavali, again in Amaja Ajirna also Vamana is indicated. That is nothing but to remove the Ama from the Koshta. We are going for the Vamana here. Same reference you will get in the Grahani also, where in Amaja Grahani initially Vamana needs to be done. So basically, for exam purpose, you need to study the first shloka, where for Langana for Ama, Vamana for Vidagdha, and Swedana for Vishtabdha. Okay. For Rasesha Ajirna, Divaswapna is a treatment followed by Langana and Vata Varjanam. So that is about the treatment of Ajirna. And some Shamanaushadis like simple Shamanaushadis like Deepana Devyas and Deepana, Vatanulomana or Kafahara or Pittahara Devyas, according to the condition we can give here. Panchagola Churna, Lavana Bhaskara Churna. As we know, again it is Deepana Churna and the Lavana itself is Vatahara and Vatanulomana. Hingwashtaka Churna can also be used, where again Deepana, Kafahara, Vatahara Devyas are there. And very rarely we'll go for the Shamanaushadis. Actually, in the case of Ajirna, we are not directly indicating in Shamanaushadis. We are going for the Deepana Pachana kind of Shamanaushadis, like these Rasonavati, Shankhavati, Lavangadivati, Hinguadivati, Hinguachadi Churna. So these can be given in the case of different types of ajirna. So while writing for the examination again, you have to write with the dosage. Like for example, churna, 1 karsha in divided dosage with ushna jala before food. Because basically for the Agni Deepana purpose, Prag Bhakta is the Aushadha Sevana Kala. So that can be written with the proper Anupana also. Any tablet or whatever it may be, with the dosage and Anupana, you have to write. So another option I'll tell, like many a times, if you don't remember the actual Shamanaushadis also, you can just rewind or remind the things which you have studied in the practical classes. So in the practical classes, obviously the Shamanaushadis will be dealt. So you can make a note of that, and whenever the theory portion comes in the examination, you can remember that and write the things which were discussed in the practical class. Coming to the second set of disorders, that is Anaha, Atmana, and Atopa. So these are the references of Anaha, Atmana, and Atopa. So in this set of disorders, the most important thing is to find out or understand the difference between these three conditions, that is Anaha, Atmana, and Atopa. So we'll discuss one by one. So Anaham is nothing but Amam Shakradva Nichitam Kramena Bhuyo Vibandam Viguna Anilena Pravartamanam Cha Yadaswamenam Vikaram Anaham Udaharanti. So Anaha can be caused by two things, that is either Ama or Shakrat. So when we discuss Ama and Shakrat, you have to think about the Sthana also. Ama will be causing the Anaha in the Amashya level. That is in the almost the proximal part of the GIT. And if it is caused by Shakrat, means it obviously to be in the Pakwashya as well as the Guda, distal part of the end of GI tract. So the Ama means again related to Amashya. Shakrat means it is related to the Pakwashya and the Guda. So basically these are obstructing the movement of Apanavata, and so it will prevent the movement of Apanavata. So, Apanavata Vaigunya will be there, and that will lead to the distension of the abdomen, which is known as Anaha. So these are the types of Anaha, Amaja as well as Purishaja Anaha. And symptoms like if the Anaha is caused by Ama, that I told already about that, it will be in the Amashya. So upper part of that GA tract and the Urdhva Yatrogata symptoms can also be seen, like Trishna, Pratishyaya, Shirovidaha, Amashya Shulam or Gurutvam or Hrullasa, and Udgara Vighata can be seen. That is obstruction to Udgara. Total Udgara may not be occurring. So these are the symptoms of Amajanaha. So that is related to the upper part of GAT and the Urdhva Sharira. Coming to the Purishaja Anaha, which is related to the Pakwashya and lower part of the GA tract. Where the symptoms like, see, Kati Prushta, Purisham Mutre, Shulam. There will be Stambaha Kati Prushta. There will be stiffness, just like in the case of Kati Graha or Grudrasi or Kati Shula. That kind of symptom may be seen in the Kati as well as Prushta Pradesha, which is related to the Pakwashya. You know the sthana of Vata, that is Pakwadhana Visheshataha, and again the Shroni, Kati, Prushta, these are the Vata sthana. Then Shula during the Purisha Mutra Pravritti, Murcha, Shakrat Vamana, one of the Asadhya Lakshana of Purishanaha, that is vomiting of fecal matter can also be seen. Shwasa, that is Pakwashaja Shwasa, the breathing difficulty originating from the lower part of the GAT, that means severe Shwasa Pravritti will be there. These are the symptoms of Purishaja Anaha, and the symptoms of Alasaga can also be seen. And the third one, second one is Admana. So again the similar condition that is there will be distension of abdomen associated with the Atopa and the Atyugra Ruja. That is nothing but the Admana. There will distension Admana Midi Janiyat Ghoram Vata Nirodhajam. Again, here also the movement of Apanavata is the cause for the condition, but the symptoms are like Admata Mubaram, Udaram, that is the distension of the abdomen associated with the Atopa. Atopa is nothing but the Vata Sanchalana or the Shabda, Guda Shabda in the abdomen. In the commentary, it is told. Then associated with the Tivra Ruja, very severe pain will be there in the this Admana. So that is nothing but the Lakshana of Atmana. So difference between Atmana and Anaha is nothing but in Atmana, the Shabda as well as Tivra Ruja will be present in the abdomen. This is another condition called as Pratyadmana. And coming to the third one, that is Atopa, that is again Atopo Ruja Purvaga Udara Chobaha, that is again severe pain and the Guda Guda Shabda. If only these symptoms are there, that means there is no distension told in the Atopa, but the Shabda is heard and severe pain is there, then it is called as Atopa. So basically, though three names are there, these names are given based on the symptoms. But when you understand the pathology, basic pathology is same. Agnimandya and the Malasanchaya, the obstruction to the Apanavata, and the symptoms are seen. So that is a basic pathology is same. That is why treatment may be always same, almost similar for these conditions. Coming to the Chikitsa, for Amajanaha, I told the Amasha is affected, Urdha, upper part of the GA is affected. Then you have to go for Vamana here. That is Vamanam. Vantam Upakrameda Samsarga Bhakta Kama Dipani. So first initial treatment needs to be Vamana in order to remove the Ama, followed by Samsarjana Krama, that is Payadi Krama, which you will follow after the Shodhana. That is in order to improve the Agni. So initially you remove the Ama. Why? Because Ama is evident there. Ama is obstructing the passage of Vata. That is why you remove the Ama first. Then go for Deepana. So that is about the Chikitsa of Amajanaha. And coming to the Purishajanaha, then Purishajanaha, there is one symptom called as Shakrut Vamana. So that is why if that symptom is there, it's an Asadhi Lakshana, that should not be treated. If that symptom is not there, then you can go for the the treatment of this condition. It should be treated with Svedana and Pachana. These are the treatments for Purishajanaha. Then coming to the continuation of the treatment, the treatments which are prescribed in Vishujika can also be used in the case of Anaha or Atmana, where you can go for even Virechana can be considered there, and then Sadhya Virechana, and again Gudavarti can be used. The Virechana Dravyas can be made into Churna, the Varti can be prepared with that same Churna and mixed with the Mahisha, the mutras of different animals, and the same Varti can be inserted after doing the local Svedana. So this is one treatment in the case of Anaha. And the next treatments like again Shodhana Dravya Kashaya, that is again the same thing, that is like the Virechana Dravyas can be again made into the Varti, and Basti, Niruha Basti can be given with the same Shodhana Dravyas, can also be planned here. Or even the same Taila can be, same Dravyas can be prepared into Taila form. So the same Dravyas can be prepared into Taila, and that can be used for the Anuvasana Basti. So basically, Shodhana Dravyas should be used in the form of, Shodhana in the sense, Virechana Dravyas should be used in the form of either Niruha Basti or Varti or Anuvasana Basti, with the Taila prepared out of that. And the treatment of Admana, so after Anaha, again the treatment for Admana, Avadarpana, Pani Tapa, that is Vedana on the abdomen with the Pani. Then or Deepana Churnas like Hingvashta Churnam, Hingvajal Churnam, Ajamodadi can be used. Falavarti, which is told in the Udavarta Chikitsa, or Basti with again the Deepani and Pachaniya Dravya Basti, Surasadi Gana Basti can be given, or any Deepaniya Gana Basti can be given here. Or Dhanyaka Jiragadi Deepana Siddha Anna. So Deepana Pachana Dravya Siddha Anna can be used at the time of Anna Kala. And for Atopa again, as we see again, the severe Vata Lakshanas are there, like severe Shula as well as Shabda. Then Vata Sanchalana, go for Sneha Virachana, Shodhana Basti, and Lavanottara Prasha. There is any Churna, which is, for example, Lavana Bhaskara Churna, or any Churna with excessive, more content of Lavana should be given for Prashana. And again, similar to that, like Amashagata, sorry, Pakwashagata Vada Chikitsa, like Abhinga Svedana, Snigdha Virachana Basti can also be planned here. So these are the Shamana Aushadhis which I have already discussed. Coming to the another set of disorder, that is nothing but the Alasaka, Vilambika, and Vishuchika. So again, we can call these conditions as the complications of Ajirna. So whenever the Ajirna is not treated, the undigested food is still staying in the koshta or amashaya for longer duration, it can lead to some of the complications with the association with the some of the other doshas. Okay, so the complications are nothing but the alasaka, vilambika, and vishujika. Vishtambhyade alasagam, chavayando visuchikam. So basically, as the food, alasaga, we know, like word meaning itself is lazy. It is not moving anywhere. The food part, undigested food will be staying in the amashya itself. That is vishtamba, obstructed there. Prayati na urdhvam na adastadaharo na chapachyade. That means the food is staying in an undigested stage in the amashya, which is not digested. It's not getting digested. That is nachapachyade. Now urdhvam, it is not being vomited out. It is not being purgated out. That is na adastadahara. So no movement, no digestion also. That is nothing but the amashaya alasi budastha. It stays dormant or lazy in the amashya, which is known as alasaga. And Vishujika is nothing but Vivde Vedana or Vede, Vayvadi Vrishagopataha, Suji Birivagatrani, Vidyadidi Vishujika. Okay. So Vishujika is another Upadra of this what is that? Ajirna, where it will lead to severe pricking type of pain in the Suji Birivagatrani in the abdomen or anywhere in the Sharira, associated with different other types of Vata Vedana. Okay. So and the third one is Vilambika. Vilambika, Dushtam tu Bhuktam Kafamarudabhyam Pravartante no Urdham Adashchayasya. Vilambikadam tu Dushchigrisya. So Vilambika is one of them, we can call it as one of the severe stage of this complication, where kapha is also associated and there is no movement of the anna, and it is dushchigritsa, that is there is treatment is sometimes it is to be yapya or even asadhya also. So out of these three conditions, we can say vilambika is a condition which is difficult to treat. Coming to the chikitsa, so adhamam alasi budam sadhyam torida mulliket. So here also, if you see, the immediate treatment is nothing but vamana in order to remove, because as I already told, the ajirna is not treated, it is staying in the amashya and it is producing the complications. So already that undigested food is staying in the amashya and it is not being expelled by vamana, adhisara or chardi, not even digested also. That is why you need to immediately remove that ajirna or ama from that. That is why the only way is to go for a sadhya vamana, because virachana cannot be done. Just because of that indigestion. And the Vamana Dravyas we have already seen, either Ushna Jala or Lavanambu can be used. So Pitwa Sa Ugra Patufalam Varyushnam Yojayatada. That is again the Ushna Jala with the Patu, that is Lavana should be given. And other treatments like Svedana, Phalavarti can be given for Mala Anulomana as well as Vata Anulomana. So from the upper part we will be using the Vamana to remove the ajirna, the undigested food, the apakwa ahara, and from the lower part we are using the phalavarti for anulomana purpose. So it is like removing the obstruction and pulling the vata down. Okay. And again the like svedana also is also administered here or advised here. And for Vishuchika, due to the severe pain, Vishuchika we have seen different types of vata pain is there, and again like pricking type of pain, Suji Birivagathani pain is there. That is why the emergency management is Agni Karma at Parshni Pradesha. Parshni, as you know, in the Gridhasi Samrati you might have studied the Parshni. which is the Adobhaga of the Gulfa Sandhi, where you have to go for Agni Karma in the case of Ishuji as an emergency pain relief. Okay. Then followed by either Upavasa and the Payadi Krama, which will you do after Vireshana Karma. This Payadi Krama should be done. So emergency management is nothing but the Agni Karma followed by the Samsarjana Krama. Langana is after emergency management, Langana as well as Langana and Payadi Krama, Samsana Krama is a treatment for Vishujika. Coming to the another important topic, but many a times practically we are not seeing, but exam purpose it is very much important, like Gulma. So Gulma also, as we know, there are types of Gulma like Tudosha Gulma, Nichaya Gulma, Sannibhasya Gulma, and Rakta Gulma is also there. So in KAYACHIKITSA aspect, we will be discussing more about the Vataja, Pittaja, and Kapaja, Gulma, Sannibhasya Gulma. Rakta Gulma is related more to the surgery as well as Prasuti Dandra. So for Vataja Gulma, the Chikitsa is Sneha Panam Hidam Gulme, Visheshana Urdhva Nabije. So if the Gulma is situated above the level of Nabi, umbilicus, treatment is Snehapanam, and Pakwashya Gade, that is below the level of umbilicus at the Pakwashya level, or in the treatment should be Basti Karma. So Basti Karma is a treatment below at the level of Pakwashya, and Snehapana at the level of above the level of umbilicus, that is Nabi, and Jadarashray is if the Gulma is in the Amashray or in the Kosta, then both treatments, Snehapana as well as Basti, can be conducted. So for Pittaja Gulma, the Chikitsa is Snigdha Ushnena Gulme Paitige Sramsanam Hitam. So Virechana or the Sramsana is a treatment in the case of Pittaja Gulma, which is caused by especially Snigdha as well as Ushna Nidana. Ushna Snigdha Ahara Vihara is causing this Gulma. Then you have to go for Sramsana. So specifically you have to see the treatment is Sramsana here, not Virechana. Sramsana, you know, it is again nothing but a type of Virechana where almost like, you know, the Aragvada is the best Sramsana Dravya that you know. So that is advised here in this particular condition. And if it is caused by Ruksha Ushnayana Sambhude Sarpi Prashamanam Param. So if the Gulma is, Pittaja Gulma is caused by Ruksha and Ushna. So two type of Nidanas are told here. See, Snigdha Ushna as well as Ruksha Ushna. If Snigdha Ushna is causing Gulma, go for Sramsana. Sramsana Chikitsa. Paktavyam Yada Pakvavyam Shlishtam Koshte Maladigam Nayatyadya Sramsanam Tadida Syat Kritamalakaha. So Shlishta Koshta, Mala is adhered to the Koshta. Or, you know, like just like Pichila Mala. That is a property of Kapha actually. That is why particularly Sramsana, because Snigdha is the guna which will increase Kapha also. And Snigdha is Pitta and Ushnada will increase Pitta. So if Snigdha Ushnadana is there, you need to think that along with Pitta, Kapha is also associated. So go for Sramsana. And if it is Rukshoshna think that Pitta is associated with Vata here. So the Snehapana, Sarpipana is the treatment. Kafaja Gulma, again, the first treatment should be Vamana. That is obviously Kapha-Chikitsa. Vamana is the treatment. And after Vamana, if the Gulma displaces from that particular space, go for Virechana. So if there is change in the place of the Gulma or dislocation happens, go for Virechana. Or other treatments like some Sneha Basti can be given, or even other treatments like Chara Karma, Langhana, Gradapana, Agni Karma, Ushna Chikitsa can be advised in Kafaja Gulma. And Raktaja Gulma, as we know, it is like a Garbhani Mat or Garbhavat Chikitsa. You should wait for 10 months, then treat the Raktaja Gulma. So these are some yogas, most important yogas told in Gulma Chikitsa, like Prayushnadigrita, Shatpalagrita, most important, Hingu Savarshiradigrita, then Pipelyadigrita, Hinguadi Churna, Shatyadi Churna, then Lashuna Kshirapaga, Vasadigrita. So these are Trayamanadigrita. These are some of the important yogas in Gulma Chikitsa. Coming to the next conditions, set of conditions like Shula, especially Shula. That is again, whenever we discuss, say the name only Shula, it is nothing but Udara Shula. Otherwise, we will specific Parshva Shula, Shiras Shula, any other kind of Shula. But if it is only Shula, that indicates Udara Shula only. So Shula also you have again types like Vata, Pitta, Kapha, Sannibhada Shula is also there. But most specifically you have Shula types like Parinama Shula as well as Anadrava Shula. So basically Ashtavida Shula is there based on the dosha. Other than that, two special types of Shula, that is Parinama and Anadrava Shula. So the other Ashtavida Shulakshana, like dosha wise Shulakshnas are there, like Vadika, Paitika, and Kafaja, Shlaishmina Shulakshnas you can study. But specifically, you need to remember the Parinama as well as Anadrava Shula. Parinama Shula is nothing but Bhukte Jiyati Shulam Tadeva Parinamajam. Tasya Lakshanam Apet Samasena Abhidiyate. So that is the Parinama Shula during the process of the digestion. That is a Parinama, Ahara Parinama. There will be, that is immediately after the food intake, there will be Shula. As the process of digestion starts, there will be Shula, that is Parinama Shula. There is after the digestion, that's Parinama again, the conversion of the food, that is Parinamajam Shulam, Jiryatiyat Shulam. Anadrava Shula, there is no relation with the digestion process here because Jirne, Jiryati, Ajirneva, anytime there will be food. Shula. After food intake, if it gets digested or during digestion or even after digestion, anytime there will be Shula, that is Anadrava Shula. And this will not respond to any of the Patya, Apatya Prayoga or Bhojana, Abhojana. If you eat also, there will be Shula. If you're not eating also Shula, if you take Patya or Apatya, anytime, there is no cure for this. Na Shamam Yadi Niyaman. So there is no Shamana for this Annadrava Shula. So these two are very much important. So coming to the Samanya Chikitsa of Shula, Vamanam, Langanam, Swedam, Pajanam, Phalavartayaha, Sharasha, Churnani, Gutika, Shasyande, Shula Nashana. So these are the Shula Nashana Chikitsa for all the types of Shula. Basically, Vamana, Langana, Swedana, Pachana, and Phalavarti again similar to the Atopadmana. Shara or Shara Gutika, Shara Churna, or Deepana Pachana and Shulahara Churnas like Shundi Churna, Jiraga Churna can also be advised here. Samanya Chikitsa. And specifically for the dosha chulas like Vata Chula should be treated with Snehana, Svedana, Udaralepa, or Payasa, Kushara, Jangala, Mamsarasa, etc. after the Agni being corrected. For Pitta Chula, obviously Vamana because Apakko Pitta, and Vamana should be here done with the Patola Patra Kwada, that is Tikta Kwada, or Madhura Devya like Ichurasa, or Shita Jala can be given for Vamana. Shita Jalapana can also be advised here. Kafaja Shula should be treated with Vamana with the Madana Phala Kwata. And the Ruksha Sweda, Pippali Shundi, like formula churnas can be given. For Parinama Shula, again, almost like similar treatment, but it is difficult to respond to the treatment. So Langana, Vamana, Viryachana, Bhakti Karma can also be given considering the severity of the pain and the symptoms. And coming to one of the most important disease, that is Grahani Chikitsa, Grahani Roga. So in Grahani Roga, if you see the chapter in Charaka Samhita also, it's a very big chapter, having so many explanations, starting from the base of Agni, then the process of digestion, different abnormal aspects of digestion, everything is there. And ultimately, at the end, he will come to the Grahani Roga. So when we discuss about the Grahani, we need to remember three things. That is Grahani as an organ, then Grahani Dosha, and third one is Grahani Roga. So what is this Grahani? Pakvamashaya Madhyastha Grahani Sa. So it's an organ or a part of the GI tract located between the Pakvashaya as well as Amashaya, in between. And what does it do? What is the function of that? What is the structure of that? Agni Adhishtanam Annasya Grahanat Grahani Mataha. So Grahani is nothing but the Adhishtana for Agni. And its function is to do the Annasya Grahana, to hold the Anna or the Ahara till it gets digested. That is the function of Grahani. Nabe Ubarisa, he Agni Bala Upastabdam Upabrahmita. Upastambam Upabrahmita. That is, again we have seen like Agni Adhishtana is Grahani. Grahani is the seat for Agni. And in return, since the Grahani gives seat for Agni, Agni gives back the Bala as well as maintenance of the Grahani. So the structure as well as function of Grahani is maintained by Agni, which is seated in the Grahani. So see the function. Apakvam dharetyannam pakvam srujati parshvataha. So the main function of Grahani as an organ is to hold the Anna till it gets digested, or the Apakwa Anna. And after digestion, srujati parshvataha, the mala should be eliminated. So these are the functions of Grahani. So we have seen the Grahani organ, its structure, its maintenance and its function also. Coming to the pathology, Durbalagni Bala Dushta Ama Meva Vimunchati. So once we have seen the Bala and maintenance of Agni is done by Grahani is done by Agni, and whenever this Agni is getting the Durbalya, Agni Mandya occurs, Ama Meva Vimunchati, total function of Grahani is lost. That means in a normal Grahani, Ama Mala should not be eliminated. It should be digested, only Pakwa Mala should be eliminated. But if Agni Mandya occurs, Bala of Grahani is lost. So this process, the Grahanyashrita Agni Dushti is known as Grahani Dosha. Okay, so Grahani we have seen, Grahanyashrita Agni Dushti is Grahani Dosha, and when that it becomes a disease where the normal function of Grahani is lost, that is Ama Munchadi, that is nothing but the Grahani Roga. Okay. So Nidanas again the same Agnimadhyakara Nidanas are the Nidana for Grahani Roga. And the Pratyatma Lakshana like Ama Vema Vimunchadi, even the Ama Mala will be eliminated without digestion. Pakvamba Sarujam Pud, sometimes Pakwa, sometimes Ama Mala, sometimes Pakwa Mala, associated with the severe pain or Pudi Gandha, Muhur Baddam, Muhur Dravam, sometimes obstructed Mala, sometimes Drava Mala like Adisara. These are the Pratyatma Lakshana. So types of Grahani again, like Vada Pitta Kapija Grahani, Sanibhaja Grahani, Khadi and the Grahani and Sangrahani. These are the types. Coming to the Chikitsa, as per Sushita, he says, whatever treatment you advise for Krimi Chikitsa, Gulma Chikitsa as well as Arsha Chikitsa can be adopted in Grahani Chikitsa. And according to Ashtangradaya as well as Bhavaprakasham, the Grahani should be treated accordingly to the Ajirna Chikitsa. Ajirna Chikitsa, how you are doing, like Agni Deepana, that should be adopted here. And even that's Langana and Deepanam. And Adisara Bheshja, the Adisara Chikitsa can also be adopted here. Because in Adisara, before treatment, we will decide whether it's Ama Adisara or Pakwa Adisara. If Ama Adisara is there, you have to go for Langanadi Chikitsa, Pajanadi Chikitsa. Same should be adopted in the case of Grahani also. That is what? Dosham Samam Niramam Va Vidyat Atra Adisaravatas. Just like in the case of Adisara, you need to decide in the case of Grahani whether it's Ama Avastha or Nirama Avastha, and accordingly you have to treat the condition. So we have different types, Samanya Chikitsa as well as Vishishta Chikitsa based on the dosha. So in Samanya Chikitsa, we are going for the these are the Ama Lakshana, Ama Avastha of Grahani and its Lakshanas like Vishtamba. There can be constipation can be there, Kapha Prasega can be there, Atti, Shula pain can be there, Vidaha and Aruchi Gaurava, these Lakshana can be there in Ama Ajirna, Ama Grahani. And if these symptoms are seen in Grahani, go for treatment like Amalingani Drushta, Sugoshna Ambunot Haret, Kalanam Vakashayana, Pippali Sarshapestada. So if these symptoms are seen, you need to understand that Ama is present in the Grahani. Ama is affecting the structure and function of Grahani. So immediately it should be removed out. You should not wait for Pachana here because it's already affecting the structure and function of the Grahani. That is why remove the Ama immediately by Vamana. That is Vamana with the Ushna Jala or Madana Falakashaya with the Pippali and Sarshava. And if the Ama is still there, it is Leena Dosha in Pakwasya, it is adhered to the Pakwasya. Even after Vamana, it is remaining in the Pakwasya. Then go for Sravyam Sadipanaihi. Virechana should be given with the Deepana Pachana Drevya. In the Deepana Drevya Yukta, Virechana Drevya should be given in the Pakwasya sta Leena Dosha in Grahani. Shariranugate Sami, if Ama is present all over the body, go for Langhana Pachana. So after doing all these things, Vishuddha Amashyasme, Panchagoladi Bhishrutam, Dadyat Payadi Lagwanam. So after doing all this, either Vamana or Virechana or Langana Pachana, go for the Ahara Krama, that is again Lagu Ahara, like Payadi Krama, again processed with the Panchagola Churna or Panchagola Kashaya. Punar Yogam Deepanam. After Ahara Prayoga, again go for the Deepana Drevya. So in Grahani Chikitsa, whatever Chikitsa is taught, everything is associated or added with the Deepana Drevya. Let it be Basti or Virechana or Vamana or the Ahara or the Deepana itself, everything is added with the Deepana Drevya. So in Amavastha, we have seen these kind of treatments. And Vishishta Chikitsa like in Vadaja Grahani, after the Amapajana, you can go for Gridaya, Snehapana, Niruha Basti, Virechana or Anvasana Basti can be given. Gruda, that's again. Nyatva to Paripakwam, after complete Amapachana, Dipaniya Yukta Sarpi, as I told, should be given in Alpa Matra, Shamananga Swesnehana, not Shodhananga in larger quantity. Okay. So Niruhabasti again should be given with the again after Agni Deepana, you should go for Snehana Svedana further and Niruhabasti. Virechana with again Eranda Taila or Tilvaga Sarpi or should be used for the Virechana with the Shara. Shara should be added to these two yogas for Virechana. And after all this Shodhana, if there is Ruksha Pakwashaya and constipation like Baddha Varchas is there due to these treatments, go for Anuvasana Basti with again Deepaniya Amla Vadakna Siddha Taila, like Changeri Adi Grudha is told. So it's a Sneha with the Changeris and Amla Devi and Deepaniya Devyas are also there that can be used. So Pittaja Grahani Chikitsa, that is Sosthanagatam Utklishtam Agni Nirvapakam Bishak Pittam Nyata Vireke Mandarhared Vamane Nava. So Virechana and Vamana can be adopted in the case of Pittaja Grahani. If it is Apakko Pitta and Utklishta Pitta, go for Vamana. If it is Sosthanagata Pitta, not too much Utklesha is there. Only pure Pitta Lakshanas are there. Ama Lakshanas are not there. Go for Virechana. So these are again different yogas like Dadi Mamla, Jangala Mamsrasa, Yusha, Mudga Yusha, Khada. These are told in the Grahani Chikitsa. Sorry, Pittaja Grahani Chikitsa. Kafaja Grahani, Vamidasya Yadhaviti. First treatment is Vamana, just like in the case of Amaja Grahani. Katu Amla Lavana Shara Tiktaischa Agni Vivadais. For after Vamana, for Agni Deepana, we have to use Katu Amla Lavana, Shara and Tikta Drevyas. So different Lagu Ahara, Ruksha Ahara, Tikshna Aharas are used, and preparations like Takrarishta, Madira, Madhuarishta also indicated in the, or Amla Takra is indicated in the case of Kafaja Grahani. Tridosha Grahani again, Panchakarma should be done based on the Dosha Pradhanyata and Amalakshana. All the previous treatments can be used here also, but based on Dosha predominance. And most importantly, Taka Prayoga in Grahani Chikitsa, very much important. It is a very sure question for theory as well as Viva examination, practicals also. Takram tu Grahani Dosha Deepana Grahi Lagavat. In Grahani Dosha, Taka is one of the best medicine. That is because it's having Deepana, Grahi and Lagava. Deepana, you know, Agni Deepana. Grahi is nothing but Deepanam Pachanam Yetsya Dushnatva Drava Shoshanam. So because of this property also, Takra is best in Grahani. And it is good for all the Tridoshas like Shreshtam Madhura Pagitvat, Nacha Pittam Pragobet. Takra is not directly Pitta Shamaka, but since it is having Madhura Vipaka, it will never provoke the Pitta in Grahani. Kashaya Ushna Vigashitva Rauksha Chaiva Kafehidam. Since it is having Kashaya Ushnata Vikashi Guna and Ruksha Guna, it will remove the Kafa, it is pacify the Kafa. Vade Swadu Amla Lavana Sandratva Sadyeskam Avidahitat. So due to the Madhura, Amla, and Sandra properties will cure the Vata also. So the Takra is said to be best for Grahani as well as Arsha. So this is the gist of this Grahani Chikitsa. Whatever like Agni Deepana should be done, Malaharana should be done, and Ama, if it is present, Ama Pachana should be done. Then if it is Pakwa, go for the Doshahara Chikitsa and improve the Prana, improve the Bala of Agni. That is a treatment, and control the Vata. Vata Anulomana needs to be done. That is nothing but the Grahani Chikitsa. These are some of the common yogas stored in Grahani Chikitsa like Jiragadi Arishta, Kodaja Arishta, Musta Kodaja Arishta, Pipali Adhyasam, Danti Arishtam, Churnas like Panchagolam, Shanga Churnam, Hingwadi, Hingwajati, Jamodadi, Chara like Kalyanagat Sharam, Chitragadivati, Kotajaganavati, Shanghavati, Chara Gutika, Gradas like Adraga Grata, Grahanyanta Grata, Shatpala Grata, Indugandam Gratam. These are also again good for. And again, some Rasosha, these are also told here, like Agni Kumar Rasa, Vadavanala Rasa. Coming to the Bhasmaga Roga, again explained along with Grahani Chikitsa, that is narrate Shigana Cafe after doing all the Langana Chikitsa, Tikshna Chikitsa and Grahani. If the person gets the Kafat Shaya in the body and excessive, if you are not stopping the treatment at optimum level, there can be Kafat Shaya and excessive increase in the Pitta and the Vata. This can lead to the very severe Agni. It can increase the Bala of Agni, and due to this, there will be immediate digestion of the food. So, Kapha is low here. You need to think that Kapha is Manda or China. Pitta and Vata are extreme, which is increasing the Agni to an extreme level. And whatever food which is taken, it will immediately be digested. Pajatyanam Taishniyad, Ashu Muhur, repeated digestion, very fast digestion. So whatever food you give, it will be getting digested immediately. And if you don't give food, it will digest the dhatus itself. Nothing like in the case of dhatu paka. If food is not given, it will digest the dhatus, which will lead to marana again. Daurbalyat, adangan, mrutyum cha nayanara. So if food is not given continuously, it will digest the dhatus and lead to the death. That is why the treatment should be like Tamatyagna. You have to pacify the Agni here, not any dosha here. Control the Agni by giving Guru Snigdha Shita Madura and Pichila, visualize Pichila, Ahara. Very heavy food, heavy for digestion. Though it will lead to Agnimandya, also no problem. Muhur Ajirna, even though Ajirna happens, also no problem. Continuously, you have to give the heavy food here, like Payasam, Krisharam, Snigdam, Paishtiga Ahara, Gudavaigrada. All these kind of are Matsya, Mamsa, everything should be given here. That is, Bhasmagaravaga Teknichikilsa. Chardi, coming to the Chardi, we have again Dosha Chardi, 4 types, and last one is Aganduja or Dishtartha Samyogaja Chardi. Samanya Chikilsa again, Amasya Utklesha Bhava, he Sarva Chardiya, Mata Langana Meva Tasmat. Here also, Utklesha, obviously, Utklesha is like Hullasa. These are again Kafalakshanas. Puraruba to the Chardi. We have to go for the Langana Chikilsa immediately at first. Prakarayan Marudajam Vimuchya Samshodhanam Kafapitta Hari. So after doing the Langana, again you can go for the Shodhana Chikilsas in the case of Chardi. That is Shodhanam Cha Bahudosha Vishayam. If it is Bahudosha Chardi, go for Shodhana Chikilsa. That is nothing but Pradimarga Harana. That is for Vireha Urdam Gadam Dosham. If it is doshas like again in the case of Chardi, there will be doshas will be coming in the Urdagati. So Pradimarga Harana, that is nothing but the in the opposite direction we have to do the Shodhana, that is Virajana should be done in Chardi. So the Virajana Dravyas like Churnani, Likyan, Maduna, Abhayana, that is for Virajana you can go for Vadan Lomana, that is Haritaki, Krtva Vagam Malana, Yet Bitwa Bandamadone, Tachan Lomanam Name, Yada Prokta Haritaki, that is why Haritaki Churna can be given with Madhu as a Leha. Or Hridya Virajana Dravyas can be given. So there is a Lekhya told in Ashtanga Hridayam, which is known as Trivrt Lehyam. Trivrt Lehyam is also known as Hridya Virajana Lehyam. That can be used here. Because the sthana of Chardi is again, the Hrilasa sthana of Chardi is from the, again, the Hridaya is involved there. Because Ahridya Dravyas can lead to Chardi. So emotional aspect or that psychological aspect of Chardi, that is Hridya. So whatever treatment you give here, so it should be Hridya. It should be pleasant to the mind as well as heart. So, and it can be given with Anupana can be used as Madhya or Paya. And sometimes, for example, if excessive Kafaja Chardi, Vamana is also indicated in order to remove the Utklishta Dosha and Utklishta Kafa. For that purpose, again, Vadanaphala can be used for the Vamana. Shamana Chikilsa, like different Chardihara Dravyas are mentioned here. You can see, like Grudas are told in Vadaja Chardi, and Badara Yusha, Kulatha Yusha, Danyaga Yusha, etc. told here, Mamsras, etc. told in the Vadaja Chardi Chikilsa. Dadima Gruda, Danyaga Gruda, and Nagara Gruda can be used. For Pitaja Chardi, again, same thing I told, like Trurtlehi or Churna with Draksha Kashaya, Vidariganda Kashaya, or Ikshurasa can be given. Other like Pitta Haradravyas can be used here also, like Chandana Kwata. Amalagi Chita Kashaya can be used. Kafa Jardi again for Amashe Shodhana and Utkrishta Kafa Shodhana, Vamana is a treatment. Kashayas like Sarshapa, like Pipali, Sarshapa, Nimba Kashaya or Madanphala Kashaya can be used for Vamana with Saindava. Draksha Rasa and Kapita Rasa can be used for Shamana. Tridosha Jardi again, like Sannival Chikilsa as well as Guduchi Kashaya can be used with Madhu in Tridosha Jardi. Dishtartha Sevana Janya Chardi, that is the Chardi caused not due to any Ahara Vihara, but just unpleasant feelings to the mind or heart giving Chardi, like due to seeing any unpleasant scenes or smelling some unpleasant smell or eating which is unpleasant, that will lead to Chardi. So the treatment is Mano Anukula Vacha, that is pacifying or consoling the person. Samashwasana, that is again consoling the person, counseling the person. Harshana, making him happy. And the favorite smells or images, showing them. And again, pleasing their mind, making them happy. And a very pleasant, very tasty food, delicious food can be given in the case of this particular Agantuja Dushtata Shevanajanya Chardi. And for chronic Chardi, Chirapravarta Chardi, obviously it will be associated with Vata Prakopa as well as Dadukshaya and Balakshaya. You have to go for the Brahmana Chikitsa, Stambana as well as Brahmana. Stambana means you have to stop the Chardi immediately. Don't wait for Langana or Pachana here. Why? Because here again, Shodhana also is difficult because it's Chirakalina. So Ama might have underwent Pachana here by that due to the duration itself. And Dadukshaya is there, Balakshaya is there, Shina is there. That's why you have to go for Stambana as well as Brahmana in the case of chronic Chardi. Sarpiguda, Shira or Gruta, Kalyanaka Gruta can also be used here in this particular condition, or Trayushnadi Gruta can be used. These are the Chardihara Mahakashaya Gana according to Charaka, like Dadima, Badara, Amalaki, Jambu Pallava, Amra Pallava, Madhulunga. So almost all are Amla Dravyas which are again Hrudyavu. That is advised here. Some other Dravyas again in the case of this Chardi according to Chakradatta. So Vrishadvaja Rasa is a Rasa told by Vaishiratnavari in Chardi. Yogaratnagadi like Paradadi Churna, Paradaganda Karpura, Kola, Majjan, Lavanga, Jiragadi Rasa, Vamanamrata Yoga, and Chabdyanda Rasa by Yogaratnagara. These are the Patya Patya. Again, based on Nidana, we have to say the Patya Patya. Coming to the last part, that is Amlabittam. Amlabittam, again, one of the most important disease, most common disease. So just to see the definition of Amlabitta, Amlam Vidagdam Chadat Pittam Amlabittam. So the basic process, pathological process in the Samprapti of Amlabitta is Vidaha or Vidagda. So Vidagda is beautifully explained by Sushruta, that is Vishushkam Annam Abhyastam Pakam Sadhum Nagachadi Pindi Kritam Asanklinam Vidaha Upagachadi. So Vidaha usually we will mistake with the burning sensation. So Vidaha is not a Lakshana, it's a pathological process of the Ahara or abnormal process of digestion of Ahara, it's Vidaha. So Vidaha is not actually related to any Kadu Ahara or Tishna Ahara. Vidaha is very much related to Vishushka Ahara, extremely dry Ahara if it is taken continuously. It will lead to Vidaha. That is, water content is not there. So obviously that dry Ahara will dry up the Kledaka Kapha from the Amashaya. And the function of Kledaka Kapha is to do the Anna Sangada Shaidilya and Anna Kledana. So if it is lost, the Ahara will stay there as a Pinda, that is a mass or a dry mass. That will increase the Pitta, it will cause the Pitta Vriddhi, and that Pitta will attain Amla Guna, which is known as Amla Pitta. So Amla Pitta, we have the different dosha wise Lakshanas are done, and Gati, Urdhva Gasala, Sadoga Amla Pitta is also there. And again, Nava Amla Pitta as well as Chiragali Amla Pitta is also there. So very soon we are now coming to the Chikitsa Sutra. Purvam tu amanam karyam paschamadu virachanam kritavanta virekasya susnigdasya anuvasanam. So there is a mistake again. Usually we will be mistaking this Chikitsa Sutra. Purvam tu amanam karyam, first to amana, then virachana, then basti. No, that is not the treatment here. So what is this Purvam tu amanam here? Purvam tu amanam means in Pura Rupavastha of Amlapitta, go for Vamana. That's what at first I told one thing. Vidagda Ajirna can be considered as the Pura Rupa of Amlapitta. Why? Because Vidaha is the process in both cases. And Vidagda Ajirna is the immediate result. As it continues to lead to Amla Guna Vriddhi and Amla Pitta. So Vidagda Ajirna treatment is Vamana, and in Amla Pitta Pura Rupa of its treatment is Vamana. That is why we can state that Vidagda Ajirna is the Pura Rupa of Amla Pitta. So in the Pura Rupa Avastha, go for Vamana. Paschat Mrudu Virajana. Paschat means not later. It is nothing but the Rupa Avastha. So in Rupa Avastha of Amla Pitta, it is Pitta predominant. Pura Rupa Avastha, it is Ajirna predominant or Kapha predominant. And Pitta will also be there associated. So in Pura Rupa Avastha, Apakwa Pitta will be there, go for Vamana. And in the Rupa Avastha, Lakshana Avastha, in actual Amla Pitta stage, Pakwa Pitta will be there. For that, you have to go for Virachana. And again, for Vata Shamana, again in the Kritavanta Virekasya, Susnigdasya Anuvasana, Sehana should be done, Anuvasana Basti should be given here. And most importantly, Shirogalina amla pitta. If it is very chronic amla pitta, astapana basti is also indicated. And again, in the second Chikitsa Sutta, I can see like for Vamana again, Padola Arishtaka Patra Kashaya is told. Padola Kashaya, Arishtaka Patra Kashaya is indicated. Then again, Virechana with the Trivut Churna or Madhu Datri Phala can be used for Virechana. So, and again for the like in Chiraga Anuvasana Basti, you can go for the Pittahara, like Tikta Gratas can be used. Tiktagam Gradam, Mahadikta Gradam can also be used, which are told, or even Pandu Hara Gratas like Kalyana Grata can be used, because most of the case for Amla Pitta, there is a chance of emotional factors also. So, Kalyanagam can be used, Panchagabhyam can be used in the case of as a Shamana Sneha or as a Anuvasana Basti also can be used. Niruha Basti can be given with the Tikta Kshira Basti, like Panchatikta Kshira Basti, Manjishta Kshira Basti, or Madura Kshira Basti, like Balamula Kshira Basti, or even Madrat Tailas, like Estimadu Taila can be used for this Amla Vitta Chikitsa, Anvasana Basti, and for Kashaya Basti with for Niruha Basti. So the Shamana Aushadhi is like Kamaduga Rasa, Padoladi Kwata, Sudasheka Rasa, Bunimba, so Bunimba di Kwata, Avivati Jornam, Shankavati, Madi Parasanam. These are the Shamana Aushadhis which are commonly used in the Amla Pitta Chikitsa. So here again, the Kamaduga Rasa, like it's explained like Jirma Jware Brahman Made Pitta Rogesha Siri Amla Pitte Soma Rogecha, Yuktam Kamaduga Rasa, one of the pure best Pitta Hara Drevyas. Padola di Kwada is again Tikta Kwada, which is good for even digestion also. And Padola is having Kadarohani, which is Vedana Drevya for motion, like Sramsana Virasana also it is good. Sudashekara again Pitta Hara, Bunimbadi Tikta Kashaya for Pitta, Avibhadigara Churna, Madra Drevya, Pitta Hara, and again Hrudya Drevya, Shodhana Drevya, Shankavati usually for whenever in the Amla Pitta, if Vata predominance is there. Bhavana Drevya of Shankavati is Amla Nimbuga Rasa, so it is again Amla Pradhana, it is Vatahara, Vatanuloma, and Shulahara also. Madhival Rasayanam again Amla Drevyam, which is again Shulahara as well as Vatanulomana. So I think we have completed the topics in this Annaval Srotas. So I'd like to thank the coordinators for this session. So I'll be continuing with some other sessions also. So for today, it is the end. Yes, thank you.
Yes, sir. Thank you so much, sir. Hello.
Yeah, tell me.
On behalf of all the students, yes, sir. On behalf of all the students and organizing team, I extend our heartfelt gratitude for graciously conducting this enlightening and enriching session, sir. Your deep knowledge, clear explanations, and clinical insights have truly helped in demystifying the complex topics and brought clarity to the subject. Your efforts have made this revision not just informative but also inspiring of all of us and bringing confidence in the future exams. We are sincerely grateful for your time, dedication, and continuous guidance. We look forward to more such sessions under your mentorship, sir. Thank you so much, sir.
Thank you. Thank you.
Thank you so much.